American Revolution, I'll bet if you ask the person on the street, are you in the middle of a revolution? They would say, no, we're at war with England, or we're fighting here, or fighting. They didn't realize it was a revolution, right? Well, stem cells are a revolution. And what does that mean? First of all, just introduce myself. I'm board certified in plastic surgery. I've been doing plastic surgery for 100 years. And about 7 years ago, I discovered that not only could I heal the outside of people's bodies and reconstruct the outside, but I could actually take their own fat cells, extract stem cells from that, and actually heal the inside. And I said, oh, that's wonderful. So I got into the stem cell world because I used to take fat out of people, did liposuction, threw it in the trash. Now I said, wow, that stuff is actually valuable. So this is for you if you're currently suffering from pain or an illness that doesn't seem to get helped by any of the traditional medications that are out there today. And there are a slew of illnesses that people get. In fact, the older we get, the more illnesses we get. One of the gifts we have of getting older is we get illnesses because our bodies cannot keep restoring ourselves the way we did when we were younger. So, these are the 5 things I want you to remember by the time you finish listening to me today. 5 things to remember about stem cells. Number 1, if you have pain, it means you have inflammation. What did I say?
Inflammation.
Inflammation, okay. And inflammation is a sore that doesn't heal. What's inflammation? A sore that doesn't heal. Right. And the best way to heal inflammation are stem cells. What's the best way to heal inflammation?
Stem cells.
Okay. It's how your body does it, by the way. The best source of stem cells is your own stem cells. Not hers, not his, not someone else's, but your own is your best source. They're already in your body. The best location or the best source in your body that we can get stem cells is what?
Your fat.
Fatty tissue. And guess what? We used to hate that stuff. Now we love it. Okay. Not really. But now what do famous athletes know about how to heal their bodies that the average person doesn't know? Jack Nicklaus had some stem cell treatments. He's a famous golfer. And they questioned him. They said, you had stem cell treatments for what? And I think he had it for something with his brain. Maybe he had a little Alzheimer's. And he kept it private, but he said, I didn't keep it private. Nobody asked. But what do these athletes know that you don't know? Take, for instance, Kobe Bryant, famous basketball player, LA Lakers. He injured his knee about 5 years ago. Everybody said, Kobe's done, he's finished, he's too old, he's not going to heal, he's going to have surgery, blah, 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 blah. He went to Germany, had stem cell treatment in his knees, cost him a fortune, like $300,000. He was back playing basketball 3 or 4 months later. Scored 30 points a game. What did he know that we don't know, right? How about, oops, I went too fast for myself. How about Peyton Manning? You heard of him?
Yeah.
Famous NFL football player, won 2 Super Bowls. Well, after he won his first Super Bowl, he got injured his neck. And everybody said, Peyton Manning is done. He's finished. He's never going to play again. And then you read a little paper, the newspaper article here and there, and it found out he was having some kind of surgery or something like that. Next thing you know, Peyton Manning comes back, wins another Super Bowl. What did he do? He actually went out of the country, just like Kobe did, spent a fortune, and had stem cell treatments in his neck. Okay? That's what he did. But you don't read about it, hear about it, because they don't want people to get too excited about this stuff, because in this country it's kind of like, oh, we don't even want to talk about stem cells, because, In Europe, they talk about it a lot. Anyway, this is Darryl Reid. He's actually a patient of mine. Darryl won 2 Super Bowl rings along with Peyton Manning. In fact, Peyton Manning wouldn't play without Darryl protecting him. Okay? And Darryl retired at the age of 32, and both shoulders and both knees were totally damaged. And he could hardly walk, and he came into this clinic, and I treated him. I treated his shoulders and his knees, and actually, like a miracle, within about a month, he started feeling much less pain. Within 2 months, he was back in the gym on the treadmill. Again, these are athletes. They're unusual people. They're high-level people, okay? Their bodies are different than the average person, but still, these guys know that's how you can heal yourself. And this is important. Ooh, I go too fast. Most people don't even understand stem cells. They read about it in the newspaper, they read some study that was done at some university and everything else, and they think, wow, they're studying this, maybe they're going to cure diabetes, maybe they're going to cure MS or something like that. But they don't realize that these are clinical studies that are not yet available for use in human beings. They have to go through the FDA trials. What I'm talking about today is available because it's your own cells. Okay? We just take them from you, put them back. Okay? And if you ask your doctor about this, he's going to say, gee, I don't know much about it, but I don't think those things work. Doctors are the most narrow-minded people on this planet. They just say, whatever I learned in school, that's what I learned, and I go like this in one straight line, and they don't think outside of what their knowledge base is. And if they don't know about something, they usually say negative things about it. Most people don't even understand what we can do with stem cells. But there is a volume of literature, volumes and volumes. I think there's more than 10,000 papers published every year about stem cells, many of which come from universities many around the world, and many of which talk about clinical application, which means treating patients with stem cells. Most of it comes from Asia. A lot of it comes from Europe. A little bit of it comes from the United States. Interesting, right? What's wrong with us? Anyway, stem cells may not be the answer to all problems and all illnesses and all diseases, but it sure as heck is one of the best things we have right now, and we have it available now. Now, if you're having pain, let's say your knees hurt, or your ankles hurt, or your hips hurt, and you're having pain, you have basically 3 choices. One, you could sit in the corner and mope and complain and say, ouch, it hurts, and whatever. The second thing is you can do the traditional route. You can take medication, you go to the doctor, get x-rays, get injections, and eventually, if nothing else works, they say, oh, we got to replace your knee joint with surgery. Does that work that well?
No.
Does anybody know about it? Knee replacement? Lots of no's in this room. It turns out, and I'm a surgeon. I understand surgery very well. Knee replacement surgery is still very far from being perfect. In fact, it's only about 50% effective. And the 50% that is not effective get reoperated on, or have complications, or have other problems, and still have pain afterwards. So it doesn't solve the whole problem. Well, what are some of the other options? Well, you can take pills. It turns out that the fourth leading cause of dying in the United States of America is properly prescribed prescription drugs. How do you like that one? The side effects from medicine is killing 100,000 people every year. You know how many people died in Vietnam in 4 years of war? 55,000. Over 100,000 people die every year because they take pills and they get side effects, allergies, kidneys shut down, liver failure. And the simplest drugs, Tylenol, if you take large doses of Tylenol for pain, you're actually putting yourself in the way of possibly having liver failure. And if you take the NSAIDs, which are the anti-inflammatories, like Motrin, Aleve, causes heart disease, stroke, and you can actually develop ulcerations in your intestine and bleed. Okay, these are not candy. Okay, they're not candy. They're very serious drugs. And guess what? Opioids, you know, Percocet, those drugs, we all know how bad those things can be for you. You can get hooked on it. You can be addicted. Okay? Very serious stuff. So pills are not the answer, right? Surgery, I mean, I said it before, you can have surgery and be worse off than you were before. You can have surgery and have a complication. And when the doctor explains surgery to you and says, you know, this operation will take care of it, do a knee replacement, it makes it sound so neat and easy, he doesn't tell you all these things that could happen. And in some cases, depending on your own health, these things are more likely to happen than others. Okay. Now, we talked about inflammation before, and I think inflammation, if you want to think about what it really is, it's like you took a wire brush and rubbed it on your skin. Okay? What does that feel like? It hurts. And it looks like this on the outside if you scrape yourself. But guess what? That's what it looks like on the inside of your knee or your hip that's hurting all the time. It's inflamed. So what's wrong with traditional treatment? It can worsen the situation. It doesn't help repair the problem. It doesn't help. It may help a little bit with the pain temporarily, whatever. It doesn't fix it. Okay, it doesn't fix. Surgery doesn't fix it either. Surgery, sometimes you have surgery, the inflammation gets worse, not better. Okay. Well, the simplest form of using your own cells to help you heal is platelet-rich plasma. Platelet-rich plasma. Okay? You spin down your blood, it forms 3 different layers: the red cells, this little area, the platelets, and the white cells, and the yellow stuff is your plasma. And we take the upper part of this, put it in a syringe, we can inject it into a joint, and it will help you. Maybe for 3 months, maybe even longer sometimes. It's called PRP, platelet-rich plasma. It's your own cells, it's your own plasma. It works great for sprains and sprains. Absolutely great. For really serious problems, it doesn't last long enough. But it's still good stuff. And it's your own. Okay, and I'm going to go through this quiz again. Pain equals inflammation. Inflammation is a sore that doesn't heal. The best way to stop inflammation is the best stem cells are, and the best place to get your stem cells are. Wow, what a good class this is. I think I'm going to give you all an A. Anyway, but remember these 5 things. It's very important. Now, what are stem cells? Okay, what are we talking about? These are, in Spanish, they call célula madre, right? It means the mother cell. It's the origin of all the other cells in your body. From when a baby is formed in the uterus, those are embryonic cells. And they form a whole human being. We're not talking about embryonic cells. We don't use those because, number 1, they're impossible to control. Number 2, there are ethical considerations, moral and ethical issues. Those are not used anymore for any kind of, medical use. But the stem cell actually can change itself into any other cell in the body, any other cell. And that's how our bodies actually survive. That's how our body. Guess what would happen if we ran out of stem cells? What would happen?
You would die.
You die. You wouldn't have, in fact, that's what happens when a person is exposed to lethal radiation. When you're exposed to, like, you know, Chernobyl or something like that, where the reactor goes wacko, and you get a lethal dose of radiation, within a couple of days, all the stem cells in your body die. And there's nothing they can do to help you unless you had stored away your own stem cells somewhere in a frozen place somewhere in a mountain, and they could get them for you and give them back, because that would save your life. So without stem cells, we don't do very well, because we have no way of reproducing all the cells. There are 200 cells in the body, 2 different types, 200 different types. Each one of these types of cells reproduces at a different rate. Skin, 7 to 10 days, the oral cavity or the intestine, every 1.5 days those cells change. The nervous system takes 1 to 1.5 years to change over to a new cell. So cells grow at different rates, but every one of these cells gets restored or replenished by your stem cells that exists throughout your body. It's a natural process. Okay, adult mesenchymal stem cells, that's what we're talking about. Adult cells, okay? They're found throughout the body, including the umbilical cord in a newborn baby. Those are still adult stem cells, even though it's not an adult yet. Bone marrow is a common source. Most people think of bone marrow when they think of stem cells. It was the first source of stem cells ever used 75 years ago. Still very successful in treating some pretty serious diseases like cancer and stuff like that, because they do exactly what I said before. They irradiate that person or give them chemotherapy, and then they give them a bone marrow transplant, which restores the entire bone marrow, and patients can survive that. Unfortunately, it's very high risk, because some people don't survive that. But sometimes there's no other choice. Bone marrow is a good source, but it's not the best source. What's the best source?
Fat.
Fat is the best source. Why? It's got more stem cells. They're in abundance. The stem cells don't start to disappear in your fat. They stay around a long time. And it's easy to get to. And most people don't mind getting rid of, 100 cc's of fat. And there's no ethical or moral issue with taking your own stem cells. In fact, this shows you when you're born, 1 out of 10,000 cells in your bone marrow is a stem cell. By the time you're 50, 60 years old, about 1 in a million cells is a stem cell. So the stem cells in bone marrow decrease with age to the point where they're very, very few after the age of 50. Okay? Whereas in fact, this graph is actually like that. It goes like that. I should have one like that. I don't have one. But it's steady. Okay? So you have a steady supply, easy to get to stuff in your fat. And we take it out with liposuction. Just like that with a syringe. It looks kind of horrible. But for a surgeon, it doesn't. And this is what a syringe full of fat looks like. That has about 30 to 40 million stem cells in it. And then what we do is spin it down, we filter it, we spin it down, we incubate it, and then we filter it. This product is before the filter, this is after the filter. You can see it's a little cloudy, that's clear. That takes out the particles that might be a little large that we don't want to put into your body. And when you look at what we get under the microscope, the ones with the darker circles in it are your stem cells, and these lighter colored cells are red cells, because the filter filters out everything except 100 microns, and a red blood cell is about 100 microns, so it gets through. We then take this substance, we actually call it has a name. The stuff we get from fat is called SVF. Stromal, that's a big word. Stromal vascular fraction. But that's really what it is. It's not just stem cells, but it's other stuff. We basically call it a biological soup. So the noodles are like the stem cells, and the other stuff in the soup is like this other good stuff that we can put inside a joint that helps it heal, such as the, is it called X?